Everyone to today's hearing on the state of competition in the pharmacy benefits manager and pharmacy marketplace. And I now recognize myself for my opening statement. When a patient visits a doctor who recommends and prescribes medication, the patient rarely receives the prescription drug directly from the doctor. Instead, the patient submits his prescription to a pharmacy, which then dispenses that ordered medicine. While this may appear to the patient as a relatively simple exchange, behind the scenes exists a complex system. Within this system is a variety of different players who engage in millions of interactions that influence the types of drugs that are available and the prices that patients pay for them. Two of the key players in this process are pharmacy, benefit managers, and pharmacies. Today's hearing will examine the state of competition in these two important markets. Pharmacy benefit managers, or known as PBMs, play an important role in the healthcare system. PBMs oversee and administer the prescription drug benefits for more than 247 million Americans, or approximately 95% of Americans who receive drug benefits. Through the management of these benefits, PBMs perform a number of varied services. They negotiate the prices of prescription drugs with manufacturers and wholesalers. PBMs design drug formalities that dictate the drugs that will be covered under a benefit plan and the cost-sharing portion the patient will bear for each drug. PBMs also negotiate with pharmacies to determine which pharmacies will participate in their networks, the fees that each pharmacy will receive for dispensing drugs, and the amount the pharmacy will be reimbursed for each drug. By virtue of their central position in the administration of prescription drug benefits, some would argue that PBMs have the ability to place downward pressure on the prices of drugs. PBMs also can achieve efficiencies that result in savings both to the ultimate patient and the payer of health benefits. Pharmacies also play a critical role in the delivery of medicine to Americans. In addition to purchasing prescription drugs, they typically are the entities that directly engage with the patients. As someone who represents a district with many rural communities, I know firsthand how important pharmacies, particularly independent pharmacies, are to their customers. Many times, these independent pharmacies develop meaningful relationships with their customers and provide essential assistance when dispensing their prescription drugs. Together with doctors, pharmacies are part of an integral team that ensures patients are receiving the proper drugs in the correct amounts and administered in the appropriate fashion. I've been an ardent supporter of independent pharmacies throughout my time in Congress. In both the 112th and the 113th Congress, I introduced legislation that would grant independent pharmacies a specific exemption to the antitrust laws when negotiating contract terms for provisions of health care items or services. This would have potentially given the vast network of isolated independent pharmacies a stronger competitive footing relative to larger national pharmacies. Whether this exemption is needed is another item to consider today. Many PBMs also provide pharmacy services either through their own brick-and-mortar locations or through mail-order services. As a result, PBMs may negotiate services with competitors to their own pharmacies. Over the years, this has resulted in tensions between certain pharmacies and PBMs. The antitrust enforcement agencies have periodically reviewed PBM activities, finding in some instances that these activities are appropriate and stepping in when they are not. Today's hearing will allow us to become better educated about the services that PBMs and pharmacies provide. The hearing also will allow us to review whether the proper economic incentives are in place to ensure that customers are receiving affordable prescription drugs and to explore some of the historic tensions between certain PBMs and pharmacies. The public record generated today will also assist the committee with its oversight authority of the antitrust enforcement agencies. We have before us Express Scripts and CVS Caremark, two of the largest PBMs and pharmacy companies. They will provide an inside and first-hand perspective of PBM and pharmacy operations, as well as an invaluable viewpoint into the prescription and pharmacy industry at large. Additionally, we will hear from a representative of independent pharmacies and one of the experts covering both of these markets. I look forward to today's discussion from this excellent panel and witnesses.